Department's Community Center today to talk about the Forward Initiative and some reports that have come out recently. And I'm going to ask Crystal Kleinschmidt, who is with me, who is going to explain Forward and a little bit about the mission and the vision of Forward.
All right, thanks, Dave. Yeah, Forward is the obesity prevention, healthy eating, active living initiative. We've been around for 6 years now, and the health department provides our backbone. We're a public-private partnership made up of over 1,200 coalition members, so community leaders, organizations, and just individuals who are interested in making the healthy choice the easy choice. And one of our main goals and impact areas for the coming years is to really work with schools, early childhood centers, and work sites to again make that healthy choice the easy choice through those environmental, policy, and systems change.
And just recently, I know Forward came out with a report that covers kindergarten, 6th, and 9th graders throughout DuPage County. What were some of the findings in that report?
Sure, and I actually have one with me. I'll just hold it up. It's called Addressing Obesity in DuPage County, What You Can Do. So we really wanted it to be a call to action piece for the community in general to realize that there's steps that any one of us can take to make it easier to eat healthy and exercise more. So the results did include kindergarten, 6th, and 9th grade data from public school students. And what we saw was 15.1%, or about 1 in 7, were obese. Additionally, we also included data for our 2 to 4-year-olds enrolled in WIC. So WIC is the Women's, Infants, and Children's Nutrition Supplemental Program. And for that, we saw that for, again, those 2 to 4-year-olds, 20.3% were obese. So we can look at different populations now and kind of have an overview through the lifespan. We also included some adult data in there showing that about 1 in 4 adults would identify themselves as obese.
And an interesting finding that came out of that I think our viewers would find fascinating is that now we're starting to look at high blood pressure even among that young population. Can you talk a little bit about that and what was found in that study?
Yes, we had the great opportunity to be able to collect the blood pressure data at the same time as the body mass index data. So what we found is of that 15.1% that were obese, again in kindergarten, 6th, and 9th grade, 44% of them had an elevated blood pressure at the time of their school physical. So granted, it's only one measurement represents only one point in time, but it is higher than we would have expected. We also noticed that as kids went up in weight, so as we went from underweight children to normal weight to overweight and then to the obese, the percentage of kids with that elevated blood pressure also increased. So really showing us that there are other things already happening even before 9th grade in some of the kids that is happening along with the increased weight.
I think that's some really interesting information for parents and adults in general. And I think they would also be interested in how do the rates for obesity and overweight in DuPage County, for example, compared to other parts of the country. Are we a little bit higher, a little bit lower, or where do we fit in?
So if we again look at that 15.1% obese for all of our kindergarten, 6th, and 9th graders, we are below the national average, which was 16.9. But when we look at our kindergartners alone, which were 14.3%, and when we look at those kindergartners, and again at that WIC 2 to 4-year-old population, which again was 20.3, were higher than the national rate for 2 to 5-year-olds, which was only 8.4%. So it's showing us that overall we're lower, but we could definitely do some early interventions with that 2 to 5 or 0 to 5-year-old population to try to create those healthy habits early on.
Yeah, and for our parents and adults that are listening, what are some of the health issues that come up with children that may have a high blood pressure problem at an early age? What are some of the issues that might develop later in life for them so that they watch out for that?
Well, I'll start by saying blood pressure, one of the reasons we collected it this year is because when an individual does, eat healthier, increase physical activity, blood pressure is one of the first things that'll start to decrease. It really responds well to those lifestyle changes, as does diabetes. So that's one of the reasons we included it, is to kind of get that gauge. But blood pressure is actually one of the things that leads to heart disease later on in life, which unfortunately is the second leading cause of death in DuPage County. So it's something to be aware of, but people with high blood pressure often do not have any symptoms until much later on.
It's a silent disease, that's correct. And in relation to that also is that beyond the health issues, a child in school, which a parent should be aware of, may face some other kinds of challenges in school related to either being heavy or having high blood pressure. What are some of the other issues that they might have to deal with in school?
Well, sometimes we see children that are obese, they're absent less because they're just not as healthy, or they may be having social issues. And there are studies that show that increased physical activity, better nutrition leads to better test scores and things like that. So really focusing on those fruits and vegetables and being active can really have a more well-rounded child.
Yeah, and I think that we really want to focus today. We've kind of laid a groundwork here of what the situation is, given our viewers a little bit of a perspective on this issue in DuPage County. But I think we also want to talk about what can both children and adults do to get healthier. Really, that's what our focus is today. That's our key message.
Yeah, so point out a couple things. One, if I go back to that report that we were talking about, the very last page has steps that anyone can do to be healthier, as well as for different sectors. So if you work in a school, or maybe you're a healthcare professional, just some steps to get you started in a healthy direction. But moreover, we are really promoting the 5-4-3-2-1-GO message, which I have here. This was created by the Consortium to Lower Obesity in Chicago's Children, called CLOCK. And as you can see here, it stands for 5 servings of fruits and vegetables a day, 4 servings of water, 3 servings of low-fat dairy, 2 hours or less of screen time a day. And that does include all that phone time is a part of that. And then 1 hour or more of physical activity. So we really adopted this in DuPage County and are trying to spread the word, because that's an easy message that anybody can do. And adult children alike. I'm sure a lot of us can pick one of those and start working on it today. We especially encourage, just adding more fruits and vegetables to the diet, and then also watching sugar consumption. So sugar seems to be in almost every little thing when you start looking for it. So reducing some of those sugar-sweetened beverages is an initial step. Instead of replacing a sugar-sweetened beverage with just water instead for once a day, and then work up from there. And also looking at menu or nutrition labels for added sugar, and trying to avoid things where there's added sugar.
Well, that 5-4-3-2-1 message, that 5-4-3-2-1-GO message seems to be pretty easy to understand. Now, if people are interested in more information, are there some sources that you can share for them to get more information?
Yeah, for sure. I'll start off by saying that you can go to the Forward website, which is forwarddupage.org. We're also on Twitter and Facebook, which link from our webpage. But also to let people in Villa Park know specifically that there is a healthy living coalition already happening out there called Grow Healthy Villa Park. And so I would encourage them to go to the Grow Healthy Villa Park website and get connected with that resource.
Well, those are real good pieces of information. We really appreciate the viewers' time and listening to our message today, which is to get healthier, eat better, get more exercise. And I appreciate Crystal taking time from Forward to be on our program today. And my name is Dave Haas with the DuPage County Health Department.